oils are able to help us with. Obviously, anti-aging, which is most of what we're doing here. Exfoliating, giving you clearer, healthier skin. Pigment evening, which I am particularly interested in because I think there's a big problem in effectively managing pigmentary disorders. They're difficult to manage, so any tools that you can have at your fingertips to improve disorders of pigmentation would be very helpful. Reducing the appearance of blemished skin, and by that we mean obviously acne. And exfoliation, treatment of dark spots, but nutritive, which is a very interesting term that's used. We're obviously not feeding the skin, but remember that glycolic acid can improve the constituents of the dermis, improve moisturization of the dermis through glycosaminoglycans, and I think that's extremely important in its nutritive effects on the skin. Okay, so I think Lorna is ready to do the peel.
What I've done so far is removed her makeup, cleansed her skin with the Restore Facial Cleanser, and then we've used the Optimal Pre-Peel Cleanser to make sure that we've got rid of any oils from the skin. It's a solvent surfactant, so the last thing you want to do is to peel somebody who's got oily patches of skin and dry patches of skin, because the dry patch of skin is going to draw that peel deeper into the tissues, and the oily patch is going to work. You've seen water on top of oil, it doesn't penetrate. So if you've got oily skin, the peel will not penetrate as well. So if your patient has combination skin and you try and put the peel on, it makes your job much more difficult. So she's had 2 weeks of prep before her first peel with glycolic acid, just to help balance out her skin so we haven't got so many oily patches or dry areas. So what I'm going to do now, having done the Optimal Pre-Peel Cleanser, is just put a little bit of protection around her sensitive areas of her face. So we're just going to use a little bit of Vaseline, and I'm just going to put this around her eyes. Some people will put covers over patients' eyes, but what we've discovered is if we do that and you put something over, then often the peel can leach underneath the iPad and actually cause a burn, whereas if you have the patient with their eyes closed and you're putting a peel on, you know exactly what's happening, and if they do get a little bit of peel, we've put some on so that it's not going to leach in, but if they did get peel in that, we can wash it straight away and you're not going to get a burn, whereas if you leave the iPads on, you can. When you come to neutralise, that's the time when it's going to be a wet procedure, and at that point you definitely want to put protection on the patient's eyes. So just the alar of the nose, and then the mouth area and the oral commissures, just making sure they're protected with Vaseline or something similar. So we're now ready to apply a 35% peel. So just bear with me while I speak to my client for a moment. So you can see that while I'm putting the peel onto the skin, I'm being very careful to make sure that I don't put the peel anywhere near her eyes, and that the pot is always carried around the side of my patient's face. Nice, long, gentle brush strokes with the peel to make sure that we've got a very even coverage of glycolic acid all over her face. Now, on a scale of 1 to 10, how is this feeling, with 8 being it's uncomfortable and 2 being you can't really feel it?
2, 3.
So it's on a scale of 2 or 3 at the moment in terms of sensation. So we're just making sure that the peel is on evenly all over. And I often ask my clients, in fact I will ask you, if I missed anywhere?
I can't feel it on my nose.
Okay. I always find if you don't ask your client if you've missed somewhere, and you have, they're very, very aware of the fact that you've missed it, and they'll sit there and they'll worry about it. It's much better to be totally honest and ask them, and they'll give you a nice, honest answer, and it helps build that rapport. So while I'm talking, I'm just going to keep brushing her face. I'll talk about the other peels in a moment. The reason I brush her face is it's beautifully distracting. You can take a fan and cool your patient's face with a fan, but with glycolic, you don't really need to do that. What you really need to do is make sure that your client knows you're here. And touch is the best way of them knowing that they're here. And using a dry brush over the peel is absolutely fine. It doesn't stimulate the peel. It doesn't change the way it's penetrating into the skin, but it reassures your client and really helps with the peel process. The 2 different peels that we layer with, you can take, when you've done your first 20% peel and your patient comes back 4 weeks later, if you've got a patient with oily skin and acne, you can then do a mandelic acid peel. And you put that on for 2 minutes, and then you apply the glycolic peel on top. The advantage of mandelic acid, it's another alpha hydroxy acid, and it comes from almonds. And it's a beautiful peel because, unlike salicylic acid, both mandelic and salicylic acid are brilliant at drying up sebum production, but mandelic acid is humectant, so it improves the amount of water, the hydration in the skin. So with salicylic acid, you effectively reduce the sebum, which is brilliant, but then the patient's skin is dehydrated, so it produces more oil. With mandelic acid, you can get a really nice balancing effect. So a combination of the two, so we use salicylic acid in home care and mandelic acid as the peel, is a really lovely balance. So I'm watching her skin at the moment, and I'm making sure that I'm looking for any signs of the peel end point. So the peel end point would be redness. Now we've got a bit of redness coming up here where she's got a little tiny blemish in her skin and a little bit of redness up here. But I'm not seeing any epidermolysis, possibly a little bit developing down here, but we've only got less than a minute to go. So I'm going to leave that to peel because that's going to give her a really, really nice peel. So I'm just going to pop some eye pads on. So if I can just pop this over your eye. Okay, so that's just going to stop the neutralizer going into her eyes. And then we have our foaming peel neutralizer. And you'll see when I spray this on, because I've got an alkaline in my hand and an acid on the client's face, when these two get together, you get carbon dioxide release. So you're going to see a white foam appear on her skin. And it's lovely because it means when you've got to the end point, when you aren't seeing foam, you know that your client's skin is neutralized, so they can safely go out into the hot air, they can go swimming, whatever. If they get their skin wet, you're not going to reactivate that peel. Okay, so I'm at the end of my 5 minutes, so I'm now going to neutralize in exactly the same pattern as I put the peel on. So I'm going to start on her forehead. And then we're going to come around this side, so you'll see now, can you see how we've got foam coming up? And I'm not drying her skin, I'm just dabbing away any drips so that it's not too wet a procedure. Okay, so now I've got to go over her nose and mouth. So we just do a little breathing exercise together. So if I can get you to take a big breath in, and now I want you to blow out through your nose, please. And breathe normally. And then we're going to do exactly the same again in just a second. Just bear with me a second. Okay, nice big deep breath in, and blow out through your nose. And breathe normally for me. Your eyes closed for me. Okay, so she's now neutralized. Okay, but what I'm going to do, just because I'm very cautious and careful, is just very quickly go round once more and make sure that there's no foaming. And that's the peel procedure basically finished. So I'm going to hand back to Maria to do some more talking while I just put a nice cold compress on and then put some post-treatment products. Maria.
Okay, thank you. Okay, so I think that looks very simple. The patient obviously wasn't distressed, but how many of you are treating people with my skin color, with pigmented skin? Right, so how do you know when the endpoint has been reached? Do you see redness in pigmented skin? It's very, very difficult, right? So this is a lovely case. In fact, I am happy to treat people like this as well. So for all of us, treating pigmented skin is a challenge. Interestingly, if patients have very dark skin, as you can see he does, the hypopigmentation settles very, very quickly. And that's because in darker skin, they repigment extremely quickly. It's Asian skin and mixed races and so on that are actually much trickier because they do not tend to repigment as uniformly as this. So just to point out again, in patients with pigmented skin, if you get epidermolysis, you can end up with either post-inflammatory hyperpigmentation or hypopigmentation like this. But in your darkest patients, it sounds like a bad outcome, but actually they will settle within about 6 weeks. Okay, so it's not that bad. And that's the same with even hypopigmentation caused by lasers as well. And here is a patient with an Asian patient again with now she has epidermolysis happening on her face, so on the cheeks. So very nerve-wracking for the patient. So you need to explain that if this is what you're trying to achieve, you're going to get very good results, of course, but the patient needs to be ready for what that involves. And that's peeling for at least a week as you would with a trichloroacetic acid peel. So the point of this is that you can use the metabolic action of the glycolic acid peels, which is what I think most of us want to do. So stick with the metabolic action. That means they get no epidermolysis. They get a bit of flaking, a bit of redness, and they're fine. But if you want a really strong and vigorous peel, as in the case of this patient who is treating acne scars, you need to treat, with a heavy peel. That's 70%. You probably need some epidermolysis to get a good result. But you can see the results are reasonable. You're never going to get rid of acne scars, but they certainly can improve.
Bring yourself right up onto the headrest.
Just before Lorna starts this second patient, and you can see this patient has quite visible acne scars with hypopigmentation. And acne scars on the right cheek as well, even with nodular acne here. And after a series of peels, the acne has improved and the scars have improved. This is very unusual to get that type of result with scarring, but those scars were quite superficial. So you can get extremely good results using glycolic acid peels alone. That's all this patient has had.
Here we have our second model of the morning. And she's not had a peel before, okay? So she's been prepping her skin, but as is very normal with clients, they often come in and say, I haven't used my prepping products quite as much as I normally would, as I would like them to. So we've talked through, she's very comfortable to have a peel, but we're just going to do a very quick, gentle 20% glycolic peel, okay? So she's had 2 weeks exposure to glycolic, but not as much as I would have liked. So I'm not going to leave it on for 5 minutes. You can see that she's got a combination skin. You can see she's got a little lesion there. So we're actually not going to treat that lesion because, if you don't mind me commenting, she has picked at it this morning. Okay, so we're going to give some patient advice on leaving our lesions alone. The other things that you need to talk to with your clients or your patients before they have their peels is other lifestyle things. I've had clients come in for a peel immediately after having had a hair colour. So that raises a question in your mind. What chemicals have they got on their skin? And if they've got chemicals on their skin from a hair colour, you don't want to be putting a peel straight on. Likewise, if they've got a day planned to be luxurious and they're having a peel in the morning and going off and having a hair colour done in the afternoon and they've only just had a chemical peel, that's not really a very good idea. We need to be careful with jewellery as well, okay? Cheap jewellery can be affected by glycolic peels, so always ask your patients if they've got cheap jewellery on. Okay, please, don't do that. Don't ask if they've got cheap jewellery. Please just ask them to take their jewellery off. So I'm just going to ask you to remove your earrings. I'm ready to apply the peel now. So obviously we've got a very sensitive skin, a much younger skin than the previous peel. So I'm going to apply the 20% glycolic, but it's going to be on for, as I said, absolute maximum, excuse me, of 2 minutes. So timer's ready. We're going to apply exactly the same way as last time, but I'm going to keep talking as we go. So when this goes on, you're going to feel it tingling as it's on. Don't be worried by the tingling. It's perfectly normal. Okay, if you don't like it, we will neutralize it straight away. So that's going on. That's great. So you can see actually applying the peel is incredibly simple and easy. We provide brushes for you. These brushes are lovely. You can apply peels various different ways. Some people will use cotton buds, some people will use gauze. I find these brushes very good because you get a very, very even coverage of the peel and no splashing, and you don't waste peel. You're not finding that actually you need 5 mils to apply rather than just 2. So how is that feeling now, my love?
Tingly?
It's feeling tingly. On a scale of 1 to 10, with 2 being it's itchy and 8 being ouch, where are we?
5.
About 5. Okay, so 5 is absolutely fine. 4 or 5? Okay. I'm watching very closely to see that we don't get any red patches coming up, looking for that epidermolysis as well. And everything is going fine here. How's that feeling? Tingly and stinging. Still about 4 or 5?
Yeah.
Yep. Okay, so it's not increasing beyond 4 or 5. If she started to say it was going to 6, I'd be talking to her, trying to give her some reassurance and looking at whether we need to neutralise. So we've got about 30 seconds left to go, and then we're going to start to neutralise. Okay, so we'll put the iPads on now. So just keep your eyes closed for me. So these are just dampened cotton pads. We'll just stop any of the neutralizer spray going into her eyes. Okay, so spray coming. How's that feeling? So you can see that whiteness there, that's really satisfying, all the white here showing that the acid has been doing its job and that we're neutralising it now. Okay, so I'm just going to go over your nose and mouth. So obviously this is the first time you've done it, so it's going to make you jump when I spray. So what I want you to do is take a big deep breath in, and now I want you to blow through your nose, and I'm going to spray over your nose. There we are. Always makes people jump, that little bit there, but it's so important to make sure that you're neutralising properly. I'm afraid there is no shortcut to that. Okay, and once more, just over your nose and mouth. Breathe in for me. And breathe out. Well done, that's brilliant. And now breathe normally through your nose or your mouth, it's absolutely fine. Okay, and we're just going to go around once more and make sure that there's nothing that shouldn't be going on in terms of failing to neutralise. That's absolutely fine. So there we are, we're all done. So now we're going to put a cold compress on. Okay, so after the peel, you want to put some nice products on the client's skin. Remember with glycolic, it's a bit like looking after your lawn. If you come along and you pull all the moss out of your lawn and you don't feed the lawn, then you're going to kill the grass. Whereas if you weed and feed the lawn, so you're putting in fertilizer as well, that's great. And glycolic is a bit like that, because glycolic is going to resurface the skin, but we also have a lot of evidence of neocollagenesis, improved hyaluronic glycosamine glycans in the skin post-glycolic. But post the peel, because the peel is a stronger glycolic than they'll be using in the home care products, we want to put other things back into the skin. So I've used a bionic serum. Bionic serum is 10% lactobionic acid, which is the third generation hydroxy acid, which is very, very humectant. If you want to see any clinical studies on that, do come and see us on our stand AestheticSource at the front of the show. You'll find us there. We've got the clinical studies to back up the science. Lactobionic acid is actually a really interesting ingredient. It's used in the US by the transplant teams because it's such a powerful metal chelator, such a powerful antioxidant, that they wash the organ out with a wash that includes lactobionic acid in the transplant process. And then to finish with, I've used daytime protection cream, which again comes from the Neostrata Restore range. So based on poly and bionic hydroxy acids, a very, very gentle humectant cream with SPF in it as well. So we've got protection there. The SPF on this is 23, so it's not enormously high. If you want to look for a higher SPF, come back and see us in about 2 months' time, and we will have a fluid SPF 50 coming that you'll be able to use. That's a physical block, so it's no chemicals in there. It's a physical block, SPF 50 for post-treatment use.
Any final questions? Okay, thank you.
Thank you very much.